Hello, today we're going to talk about breast MRI and papilloma. My name is Gillian Newstead and I am medical consultant to Clarity Imaging and serve on the advisory board of Medscape. This is the QuantX indication for use. Please see risk information at the end of this video. So we're going to evaluate today a small enhancing mass. Patient is age 72 with BRCA2 germ mutation. She has undergone routine mammography screening and also screening with MRI. And this is the 10th module of her screening MRI protocol. Here we can see the right breast mammogram, and we can note that there is no significant abnormal finding on the right MLO or the right CC view. Now we're going to look at the QuantX application, and this is the first hanging protocol. We have the MIP in the upper quadrant, and the remaining are showing the multiplanar reformatting of the T2-weighted non-fat saturated sequence pre-contrast. So we're going to start to look at the MIP image, and we're going to go full screen on that. And here we can clearly see a small enhancing mass. It's actually smaller than 5 millimeters, quite obviously enhancing quite a lot. We have a good bolus of contrast. The technique of contrast injection is good, and we have some draining veins and contrast in the vessels, which also will allow a good technical bolus for us. We also have enhancing in both sides. We have the foci, enhancing foci, probably due to merely background parenchymal enhancement. So with the MIP image, we have a lesion in the subareolar region, which we need to evaluate further. Now let's look at the T2-weighted images. I'm going to click on the lesion in the right breast on the MIP, and this is going to bring us to the exact location of the lesion in the sagittal and coronal planes, which is very helpful actually to know exactly where it is. We have not seen anything else on the T2-weighted images that is of value, so we're going to move on to the post-contrast source images on the next hanging protocol. And here we see the enhancing mass that we saw on the MIP image in the sagittal coronal axial plane. These are source post-contrast images. And we can scroll a little bit around. We don't see any other particular lesion. If we did scroll through this entire breast and we did not find anything else. So I thought we could put the kinetic map on the lesion. We can try that. So here we go. We're going to click on the kinetic map on our lesion, and you can see that there's washout kinetics and some persistent kinetics within this mass. So we've done the kinetic map, and we're going to take that off. And now we're going to segment our enhancing lesion and see if we can evaluate the lesion better. So we're going to click on segment, and then we're going to click on the lesion. Now you see how quickly this happened. We can see the time intensity curves up here on the right, and the turquoise curve is the most enhancing curve within that tiny lesion, and the purple curve is the average enhancing curve. So these are very helpful. We also have nice diagnostic analyses in terms of volume, effective diameter, and surface area. So the volume here is 0.022 cc's. Effective diameter is 3.5 millimeters. So it's a very small lesion, as we know, and the surface area is 44.7 millimeters. And now we can look at the QuantX score, which is 39. So even though we had washout on the kinetic map, and we have an indication that perhaps it could be a more malignant looking lesion, here on the QuantX score, we're more in the benign domain, and then therefore we have to think about where our lesion is. The morphology of the lesion is very smooth, and because of the subareolar location, it could well be a papilloma. So the QuantX score is telling us that it's more in the benign than the malignant domain, and therefore perhaps we could consider that we could give perhaps a BARAD 3 designation where we follow the patient for 6 months, or think about a more benign lesion certainly than we might have expected without the QuantX score. And we can go to the last hanging protocol, which is the subtraction imaging. And here we see the subtraction image and the technical aspects of the subtraction technique, but no additional enhancement is found there. That really informs our analysis here. Using the QuantX score is helpful for diagnostic purposes. The pathology results revealed a 5 millimeter subareolar mass. The MR-guided biopsy of this small mass proved to be a large duct papilloma without atypia. Papillomata in the large subareolar ducts often are present as small, circumscribed masses, and they often have washout kinetics, which may become a little difficult for analysis and reading by the radiologist. So we have to be sure that there is very smooth margins, and the location, again, is helpful for diagnosis. Nipple discharge may often be present, and biopsy of this type of lesion in a high-risk patient is usually recommended, and MR-guided biopsy is often the preferred method for tissue sampling. Now let's look at the pathology of papilloma, and typically what we see are arborizing fibrovascular cores protruding into the lumen on a little stalk, and associated epithelial proliferation of varying grades can be seen. Large duct papilloma is also frequently associated with apocrine change and atypical ductal hyperplasia. Associated stromal sclerosis calcifications can be present and seen on mammography sometimes. Indication. QuantX is indicated for the assessment and characterization of breast abnormalities from MRI data in patients presenting for high-risk screening, diagnostic imaging workup, or evaluation of extent of known disease. QuantX is not intended for primary interpretation of digital mammography images. QuantX is not intended for primary interpretation of digital mammography images. Labeling also provides information to users about potential limitation of the device related to specific subpopulations for use by licensed healthcare professionals only.